to affect the heart valve or the brain.
Okay.
And you get small infected clots that are,
Oh.
that's what those are.
Okay.
And
And
call
now
them embolic phenomenon. Well, the transthoracic echo was done,
Okay.
and they didn't talk about any vegetations,
Okay.
but it's not the best test. So we've ordered the other test. It's called a transesophageal echo. They're going to go in, like
oh,
doing a
that's
scope.
today at 12:30. Yes.
Yes.
Okay.
So we're
correct.
waiting on that. But I don't even need that test. Looking at this tells me that there is evidence of heart valve infection.
Okay.
There is definitely. And whether or not the transesophageal echo shows me anything, I'm going to treat him as such.
Okay. And so
That
you
makes
can
sense?
treat them. You can treat them.
Yes. Well, treatment is essentially, step number 1 is antibiotics.
Right.
But there are times, depending on how aggressive the infection is, there are times when the antibiotic alone will not be enough, and if the heart valve is badly damaged, then they're going to need surgery.
Okay.
How do we know it? Clinically, whether he's doing better or not,
Okay.
depending on his symptoms. If
I
everything
see.
starts to get better, we know we're on the right track.
Okay.
Sometimes you can be on the right track and suddenly something may not go right.
I see.
Because if there's infection in the valve blows. You may be fine for 4 days. Suddenly, when the valve blows, things go downhill.
Okay.
They develop congestive heart failure. Fever that was down starts to come back again. They start to get more short of breath. So those are things that we're going to have to kind of keep an eye on and see how he evolves.
Okay.
Okay.
Mm-hmm.
So shortness of breath. The chest X-ray looked fine, but the other thing that staff can do is it can cause the same, those emboli, septic emboli, it can cause it in the lungs too.
Right.
And so a CT of the chest would show me better. So within complaining of it, I think we'll just do one to see if there's evidence of emboli.
That's
But if there's emboli in one place, I worry that it's there in other places. Same septic emboli can go to the spleen, can go to the kidneys, can go to the brain.
Right.
And wherever it goes, it can cause symptoms.
Okay.
If it's in the brain, it can cause stroke-like symptoms.
Oh.
If it's in the kidneys, you can suddenly have blood in the urine.
So will you be able to tell anything with the MRI that was done?
Yeah, I haven't looked at the results yet.
Okay.
Well, I don't think they were back. Were they back?
Well, he just went down this morning.
Okay, so that's why it's not
half
back
of
yet.
it.
Yeah, it's not back yet. So maybe we should know later. If there is evidence of small strokes, based on the distribution of the strokes, they are able to say if these are embolic.
Okay.
He's looking better.
Yeah.
But his blood cultures, when he came in, we started him on antibiotics, and I ordered repeat blood cultures the next day. The next day they are still positive.
Right.
Okay? So I've ordered them again for today. Yesterday came back positive, so I've ordered them again for today.
Right.
How we clear the infection, because if it's bacteria still circulating, it has the potential to still cause a lot of problems.
Right.
If we've cleared the bacteria in the blood, then then we can breathe a little bit better. So we'll see what the blood cultures come back today as.
Okay. And we'll know
in
that in 2 days. Is that right?
Maybe by tomorrow.
But
Usually, they hold blood cultures for 5 days, but in 24 hours, the longer it takes to turn positive, it helps. Like the first repeat set that I ordered came back positive within 24 hours.
I see. Okay.
So even if it takes 48 hours, I'm going to feel a little bit better.
Okay.
That means it's working its way out. It's just taking its time.
Right. Okay.
Now, if the blood cultures stay persistently positive, I'm going to be worried that there is some focus inside, an infected focus sitting inside that's still showering,
right.
Showering infection outside. So one step at a time.
Okay.
The difference in this time frame is I know that the staph is not the resistant staph, it's the sensitive staph. So I have transitioned him into a much stronger antibiotic.
Okay.
So I'm hoping that this transition will make the cultures negative.
Okay.
This second antibiotic that I put him on is every 4 hours round the clock.
Right, yes.
But, usually we can put an IV line in to kind of not have to poke him every 4 hours.
Yeah.
But I haven't done that yet because I need negative blood cultures before I can put an IV line where, that line stays and he can get all his doses. He gets poked less.
Yeah.
Makes sense?
Well, they're having trouble finding. You can see they tried.
I know.
A lot.
I know.
So that's why she kept this one in.
Yeah. Yeah. Well, no choice, because I really want his blood cultures to be negative.
Okay.
One of the other options, because if I put a foreign body in when the blood cultures are positive, we are going to infect that line too.
Right.
One of the possibilities that we can do is put a line in, understand that he's still bacteremic, he still has positive blood cultures, the line is going to get infected, and eventually when he's better, pull that line out and then put another one in. That's something we could do. So it's just that we'll have to do it twice.
Yeah.
But if he's really running out of IV sites, I might just do that, because
Yeah, that happened yesterday, she said. I asked how, and the gal didn't really know.
I don't know if this is another of those embolic things that's happening here, because it looks, he wasn't poked anywhere here. Unless he
No,
was
but you could
poked here.
see something was taken off. Doesn't it
Yeah.
look like something was on there?
Yeah, maybe he was poked here, and then it became a phlebitis,
Mm-hmm.
So mostly in the feet where I can see the emboli. I don't see much in the hands. Oh no, I do see, look at that.
Oh, yeah. Mm-hmm.
Nice swelling again too.
Swelling is to be expected, because what I'm giving, this every 4-hour antibiotic, it's all in normal saline. So imagine the amount of sodium load that he's getting. He's
Okay.
getting a lot of salt with the antibiotic. Swelling will be expected.
Okay.
Now I'm going to have to separate that out from swelling due to heart failure, because that can happen due to persistent infection. So that's something that we're going to have to keep
Are they
in
going
mind.
to put him on a heart monitor to check to make sure?
Let me see what all they have
What
done.
about this-
I'm going to order
What
some
about
more.
as far as getting cold water?
I'm sorry?
What about as far as getting cold water?
he's
on-
so-
After the
thirsty.
test.
So
For the
thirsty.
test, you're NPO. So until that test is done, I don't want you to have anything to eat or drink.
But then you can drink as much as you want, huh? He's been so thirsty.
Hello. Oh, hi.
Hi.
Hi. Are you from?
ID.
Oh, okay. Okay.
He looks okay.
Okay.
Better today, right?
Oh.
Any issues? TE later today.
TE in a little bit, and then we're getting the dosages worked out.
I'm wondering if we
So-
should get a PICC line in. I was waiting until the
I
blood
think that
cultures
was-
came back negative,
Okay,
but his sites are really bad,
they are.
and every 4 hours will be. We'll put one in today. We are gonna have to change it out, because
Yeah.
once the blood cultures are negative, I'm gonna have to put a new one and then take this one out.
Oh, okay.
That's the reason I'm holding off on it. But
Uh-huh.
now the weekend comes, and
Yeah.
if we run out of IV sites, that's even going to be
That's
even
gonna
more
be rough.
dangerous for me.
Yeah.
So we'll put one in today,
Okay.
but when he's no longer bacteremic, we're going to have to take it out and put a new one,
Okay.
because I know it's going to seed
Yeah.
the line.
Okay.
Not much gets done on the weekend, and I hate to not have IV sites and not be able to give him the antibiotic for any reason. For me, that's more important. So let me order a PICC
Okay.
and TEE today.
Yeah, it's scheduled in about an hour and a half.
Okay,
Uh-huh.
okay. That's
Okay.
all we're gonna do today.
Okay.
Is he getting IV fluids also?
No. I don't
Okay,
think so.
just the antibiotic, right?
Yeah.
Because he's already starting to swell up. Some
Yeah,
of it is
it's
the
just
antibiotic.
yeah, it's done actually. You're just getting a little bit to flush.
Okay. He has signs of endocarditis.
Okay. So
Straighten your leg. Straighten your leg. Straighten your leg, Travis. He's so tall. Look at this. Where did we see? See all these? These are embolic phenomena. See here?
Okay.
And then I see some in the hands too. So I think he does have endocarditis. EKG done?
I'm not sure about that. I've been running my hiney off this morning. I haven't had a chance to look at everything.
So, because I'm already seeing embolic phenomena,
Okay.
we may need a telemetry.
I think we need
Yeah.
telemetry.
Yeah, I
Okay.
think so.
Okay. Do you want to put that in?
Yeah.
And we'll get it set up.
How do you
Okay.
want me to put it in?
I can do it if you don't know. I just
Yeah, no, tell me how to do it.
it just
Because I
you
have to-
just put cardiac monitoring.
cardiac monitoring.
Yeah.
Yeah, put that in. Okay.
And then we probably want to talk to Dr. Arumagam because we've been talking with his clinic and all of that. So make sure you're all on the
Yeah.
same page.
Yeah.
But
Yeah. Is she here?
she's up front. Yeah.
Okay.
Are we able to talk? Do you want anyone out of the room?
You want me to leave, Trev?
Huh?
Is it okay if I sit here?
They're gonna talk about the methadone.
Yeah, it's fine.
It's okay? Okay. Okay, so we've been having a little bit of trouble figuring out your dosages because I know you're going to the clinic, okay? So by state law, they have issued you methadone. And so when we go to try to give it, it looks as if we're giving more than what you're supposed to be getting. So we can't do that. So
Okay.
we can give you your daily dosage here, and that's what we're having to get set up. But what they require us to do is to get your methadone that you have been given by the clinic and lock it up until you go home. So that's what this is, a pharmacist.
Hi,
This is
Erica.
Erica. Did I say it correctly? I think this is what she's here to help us do, and we would just be holding it because we want to make sure that you're not getting more than we're supposed to by law give you. Does that make sense?
So
Yeah.
all it is I'll look at the bottles, we'll go through them together. We'll document how much you have. When we take it from you, we're gonna lock it up in a safe. It has your name on it. No one else, it's not for anyone else. And then when you leave, what we'll do is we'll bring it back up to you, and then we go through and make sure that what we had at the beginning is what we have at the end.
So Travis, they're basically saying that they would give you your methadone from the clinic.
Yeah, I know.
So, is that okay with you?
Yeah. I'd be fine with that.
Okay, so we need to get the methadone that you have been given, that's your home med, and let her count it and put it away. And we'll give it back to you when you go home. And then that way we can start giving you your daily dose here. So,
And
Why are
that's,
you
is
breathing like
that,
that, Travis?
Huh?
Why are you breathing so noisily? Just started?
No, he's been doing that for a few
he's
days.
been breathing like that.
since I got here.
Yeah, he's doing that yesterday too.
I'm gonna get a CT chest to see if
Okay.
there are septic emboli in the lungs.
Okay.
Okay? And cardiac monitoring, TEE, antibiotics don't change, and a PIC. So he's gonna be busy today.
We'll all be busy
Yeah.
today.
Okay, thank you so much.
You're
Appreciate
welcome.
it.
Over the weekend, you will see my partner, Dr. Ramos, Elizabeth Ramos.
Okay,
I'll give you a card so you know who I'm talking about. If I've not run out of cards, yes. You'll see my partner,
okay,
and she'll know everything. She'll just pick on or whatever, and then I'll be back Monday.
okay.
Okay?
Thank you so much.
You're welcome.
Thank you.
And so,
Appreciate it.
did you check with whoever you have to check with to make sure that the methadone isn't
They
gonna
have been
interfere
on
with
the
anything else
phone.
that they've been, that they're
Dr.
doing here?
Rumagam is calling. She called the clinic. She talked with the physicians there, I guess.
Oh, yeah, no, I'm not
And so,
concerned, but
yeah.
But are they
because
familiar with the
that's why-
antibiotics?
That's why what we do is we give what our stock of medications and we put it on his medication profile. So when the pharmacist review new orders, we're able to see exactly what he's taking and if anything interacts. That's why it's best to take
To
our
take it from-
supply
I see.
rather than you take it, so that
Yeah.
everyone knows
Got it.
what he's on.
Yeah.
So
And
it's
as
the
far as
safer
it,
way.
yeah, and your question was, is it going to interfere with anything? It's way worse for him to not have it.
Yeah, I know, but
Okay.
I just wanted to make sure that it's not gonna slow down any
Yeah.
of the antibiotic stuff you're giving
No,
them or
we-
anything
you
We
know,
else.
would know, yeah,
Yeah.
we would contact the physician if we thought there was any kind of drug interaction.
Okay,
Yeah, these guys
Yeah.
watch it really closely.
Yeah, we monitor
So-
it all.
So we just need his home supply.
okay,
and-
I'll have to contact Becky and ask her to bring it up today.
Perfect. Okay.
So you don't have it with you here, okay.
No,
Not
you know, I'm
Oh, okay, I
his
guess it was
mother,
on you.
so,
Yeah,
Okay.
his
okay, that's fine.
fiance has
We'll
it.
just call you guys
Okay.
when it gets here, then just let me know and then we'll get her to come back.
Okay,
Okay?
Okay.
thank
And
you.
then several procedures will be happening, so I'll just try to keep you abreast as best I can.
Okay.
Okay? Okay, Travis.